I love you. I kissed her. Mommy, love you. You're my baby, my heart, my angel, my everything. She looked up to me. She kept me going, you know.
Aasaiya Jackson, also known as Saya by her family, was only 8 years old when she died last week. February 14th was Jackson's last day of school at Norris Elementary, and she came home that day complaining of a headache.
She was playing out in the backyard, and she came back in and she had told me, she said, "Mommy, my head hurt." And I said, "Okay, baby." I gave her some pain medicine, which was children's Tylenol, and I told her to go lie down, and you know, when you wake up from your nap, your headache will be gone.
Trishina Red said her daughter had a fever from February 14th until that Sunday on February 16th.
That Saturday, my daughter was out playing with her dad. She was playing in the backyard. She was playing with her cousins, and she was just like her normal self. So I treated her as if it was just a regular fever thing or regular common cold. And
Red said over the weekend her daughter had vomited twice and had a fever through the weekend. On Monday, she said her daughter's fever went away but came back Monday night. So she took her to Adventist Health's emergency room on Tuesday morning.
I told the doctor, I said, "Hey, my daughter is complaining of throat pain. She's also complaining of chest pain." I said she also vomited twice, which was on Saturday. She vomited twice on Saturday. I said, but she hasn't vomited since then.
Red said the physician examining her daughter performed a nasal swab.
He came back and told us that, hey, your daughter tested positive for influenza B. And I was, asking the physician, like, can we get some type of, antibiotic for my daughter? And he was like, no, I'm not going to treat this as an antiviral infection because antibiotics wouldn't work.
Michelle Corson from Public Health said that the flu season has been unique because two strains have been circulating, strain A and strain B.
The CDC has come out this year and said that so far influenza B has impacted the younger children in particular this year. It's a strain that we haven't seen circulate in many years. So what that says is a lot of us older adults have perhaps developed an immunity because we have been exposed to this virus in the past. But these younger children have not.
Jackson's mom told 23 ABC that her daughter did not have the flu shot.
No, she didn't get the flu shot. And the reason why I don't give my child the flu shot was because I worked in the medical field before. Like I said, I worked 2 correctional facilities, 2 convalescent homes, and working in the medical field, you have to get those shots because you cannot work around people without not having those. I had my own personal experience where I actually got sick after I took the flu shot.
Red told 23 ABC that Adventist Health informed her that her daughter would be fine, but to expect possible vomiting. Red also stated to 23 ABC that it took her 24 hours to receive the Tamiflu.
The reason why I had issues with getting her Tamiflu was because of Kern family told me they denied that they were going to cover the medication. They told me that they couldn't cover it and that they wanted a generic kind.
According to the medical record shown to 23 ABC by the family, the doctor noted that Tamiflu may not work as prescribed because the patient was, quote, 4 days out.
Yeah, he said the only thing is to help treat the symptoms. That's all. They said it's not a cure or anything. And he was like, I wouldn't even recommend it, but he was like, I have to give it because she has been diagnosed with influenza B.
Red said on Wednesday her insurance approved the Tamiflu and she picked it up and filled the prescription.
She couldn't keep anything down. It is now Wednesday. Like I said, she couldn't keep anything down. And, I'm telling her dad, like, hey, we got to try to get this medicine in her system somehow. And next thing I know, I hear Dad, he said, wake up, Aasaiya needs you. And I immediately got up out my sleep. And when I went in the bathroom, my daughter, she was laying on the ground. And she was still conscious. I'm like, baby, get up. You can't be on the ground, And I set my baby on the toilet. And I'm like, Aasaiya, are you okay? I'm trying to get her to talk to me so I can see what's wrong with her. And then I just seen her eyes just roll. She was like gasping for air. And I just seen her eyes roll to the back of her head. And I told her then, I said, we got to call 911 right now.
Red said 911 dispatch told her to begin performing chest compressions on her daughter, and she performed chest compressions until help arrived. According to Red, Hall ambulance transported her daughter to Bakersfield Memorial Hospital.
I was inside the room. I'm yelling, I'm crying, I'm telling my baby, be strong. You know, mommy is here. I'm not going to leave your side. And
Aasaiya was pronounced dead early Thursday.
she kept me quiet. She's the one who kept me going.
Corson told 23ABC that parents should be vigilant this flu season, and if they begin to see warning signs, to get medical help, because children are susceptible to developing things like pneumonia and other complications, and prevention is key.
What we do know is flu season is still heightened right now throughout California. The California Department of Public Health has indicated that it is still widespread. So we know the season is not anywhere over right now. It could go on into May. So it is not too late to get your flu shot. We prefer you get your flu shot at the beginning of the season, but it is not too late to get your flu shot.
Also teaching children good hygiene, such as washing your hands and covering your coughs and sneezes. Corson said the most important measures you can take is getting your flu shot and taking everyday precautions to protect yourself, such as practicing social distancing, good hand hygiene, and avoid being around others that are sick. And anytime that a parent sees warning signs, the best thing you can do is seek professional medical attention.
Sometimes people are confused, well, do I have the cold? Do I have the flu? And what would be the differences? Anytime you're concerned for your child and they are indicating that they are having difficulty breathing, or their fever is high, or they are showing signs of dehydration, whether that is potentially a cold or the flu, those are signs to pay attention to. And it's better to err on the side of caution and take your child to the doctor just to make sure, if you yourself as a parent are concerned with those symptoms that you're seeing.
Now, as of today, there have been 11 flu-related deaths reported in Kern County for this year's flu season. We do want to mention that the 8-year-old girl's cause of death has not been released.